Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 3 natural steps that you can take at home to relieve or stop plantar fasciitis pain and potentially avoiding surgery. But before I do that, I will go over what is plantar fasciitis, the normal healing cycle, and the current treatment that's used that doesn't work for plantar fasciitis, and at the end, we'll go over the steps you can take at home to relieve it naturally. What is a plantar fascia? So fascia is act like here in the plantar part it act like shock absorption, and it's like a bowstring that's on the bottom of your feet. So when you apply some weight on your foot, it can kind of absorb the pressure, so it will not be too much impact on your joint on your feet. So it supports your arch and it relieves the pressure when you take steps. And you can see it here, the plantar strain that's happened, especially if you have pronated foot, which is like your foot is inward collapsing, the arch is collapsing inward or outward collapsing. That's for excessive supination. That's very common with those patients to develop plantar fasciitis. So when you experience plantar fasciitis, you're usually going to experience heel pain, and you're going to feel like pain initially in the morning, the first few steps you take, and then the pain starts to decrease throughout the day or throughout the movement. And anytime you rest and you start to walk again, your pain will come back. So usually the severity of the pain after rest, and you feel like a stabbing, sharp, needling pain that in the plantar part, or you can feel it also on your heel. For severe cases, that pain lingering longer. So we can see it here in the plantar fascia. That's by definition fasciitis. Anything ending with itis is inflammation. So by definition is inflammation in your fascia layer. But this happened from micro tear from either bad anatomy or bad gait pattern, or the way you walk, or you had trauma that caused micro tear there, so you start to build the scarring in this area and inflammation in this area. And when you start to palpate, you will feel like there is kind of rubbling feeling or nods there. That's usual scarring, and you will notice a little bit swelling in some cases. That's inflammation in the plantar part. So for the plantar surgery, what they do, they actually open it and cut, and they cut to the fascia layer to loosen up the tightness that happened from the inflammation and the scarring there. The problem is with some patient could develop excessive scar tissue, and that could cause complication and actually defeat the purpose of the treatment. So when we look at the complication of the surgery, you might develop excessive scar tissue and inflammation, which is actually the original causes for the plantar fasciitis. So it might defeat the purpose of the surgery. And the other problem is, especially on that area, the wound will heal slowly because you need to walk on your feet unless you're not putting weight on it. So it will take forever to heal when you have any cut in your plantar area. Also, side effect of the surgery, nerve damage, infection, and recurring heel pain. That's common. And as you see here, with plantar fasciitis, you see a lot of inflammation. So what you should do at home, before I answer this question, we're going to go over current treatment, and we look at the normal healing cycle so we understand how to get to the root cause of the problem. So I'm going to use external paper cut for visualization, but the same normal healing cycle happens in the entire body, especially for the plantar fasciitis. So the first stage of healing is inflammation. As you can see here, swelling, redness, the blood starts to rush to that area. And by definition, your plantar fasciitis, you always have inflammation here. So that's inflammation in the fascia layer. The second stage of healing is called the proliferation stage. that's when your body starts to build the scar tissue. And you can see the scarring here, and that's part of healing. So when you have a micro tear from bad shoes or a bad anatomy of your foot, or the way you walk funny, you start to have a micro tear in your muscles. Your body has to build the scar tissue. If your body does not build the scar tissue, it's open wound susceptible for infection. So actually, scar tissue very essential for our survival. We need that. The problem is we don't need too much of scar tissue, because when you look at the plantar area, when you have a scarring and you have inflammation there, and instead of you have that elasticity of the plantar fascia, it's going to be more rigid, and it prevents the shock absorption, and you start to feel pain. And some patient, when you palpate, you will start to feel a knot there. That's a scarring, and that's actually feel like, and I personally had plantar fasciitis before I used those tools on myself. And you feel like you were walking on a rock, or needles, or sharp edges. And when you palpate in the plantar part, you will start to notice ribbling or scarring there. We don't need those scarring because it's in the way of your tissue, and actually your whole body weight on it, and that's what causes excessive pain. So during this stage, actually, the proliferation stage, the body builds the scar tissue. Perfect scenario, actually, during the maturation stage, your body should clear up the proliferation stage and inflammation stage, and everything clears up. For chronic condition, chronic plantar fasciitis, your body going back and forth between inflammation and proliferation stage. So what is the solution? So I'm going to go over a few treatments that currently used that's not effective based on the studies, and we'll relate that to the normal healing cycle, so it makes sense, so you don't have to waste your money and time on non-effective treatment. So ice and steam and heat, that's not going to break your scar tissue here, and temporarily going to decrease the inflammation, but based on a study, there is systematic reviews indicating that those are temporary pain relief, not providing long-term. Massage, joint mobilization, acupuncture, stretching. Think about this way: you have a scarring and inflammation in the tissue. It's like you have a knot in the tissue, and your muscle should act like a rubber band when you contract and relax. So if you have a knot there or micro tear, and you stretch it by force, you're going to cause more tear, more inflammation, and actually studies showed stretching could cause more inflammation. So when we look at this literature review, they reviewed over 16,000 research articles, and they found that these treatments provide short-term pain reduction or no pain reduction. As you can see, stretching exercise, 8 systematic reviews, they confirm that does not help with pain. Acupuncture, trigger point injection, so on and so forth, and this list that does not provide, and massages also to in here, massage 3 systematic reviews, which actually reviewed hundreds or thousands of studies, showed it does not provide long-term pain reduction. So what should we do? We should break that vicious cycle from both ends, the inflammation stage and the proliferation stage. So first thing I will do is addressing the inflammation. If it's a minor inflammation, rest should be good enough. But when you have a chronic plantar fasciitis, rest is not going to be enough. So what I personally do, and I recommend for my patient, is getting the MagnaHeal 2. This is very strong magnet that the range of the magnetic field is 3 inches to decrease inflammation. And I usually have patients take the magnet from inside here and put it in their sock and sleep with it to decrease internal inflammation in the plantar fascia. The other thing that's very important to address at the same time is putting patient on anti-inflammatory diet. That will help to decrease the chance of having inflammation from certain food that cause inflammation in the body and slow healing. For severe inflammation condition, that if the pain level is on a scale from 0 to 10 and your pain is 7 and above, that's indicative you have severe inflammation, you have a severe damage in the tissue in the plantar part. And for those patients, we have to provide anti-inflammatory supplements, natural supplements, vitamins and mineral, and other vitamins and minerals and ingredients that help to repair the damaged tissue because it's a so severe condition. So the second thing we have to work simultaneously on is breaking the scar tissue. So I want to show you in this image, normal muscle look like nice and smooth like this. When you have micro tear, it usually happens randomly. When your body starts to build the scar tissue, it's happened randomly here, like as you see in this image. But the problem is with plantar fascia, you don't want that scar tissue because you're gonna feel like you're standing on a rock. That's too much, and you will lose the elasticity of the fascia band that used as a shock absorption. So what I personally do, I use the A3, and I have my patient use the A3 to work on breaking the superficial scar tissue, and then after that using the A5 to break deep scar tissue. The last thing you have to work on simultaneously, and that's extremely overlooked by a lot of healthcare providers because there's not a lot of effective treatment to address it. And I'm gonna go over the fascia system briefly, but it's a very complex system. But don't worry, the treatment is very simple. And by definition, it's plantar fasciitis, it's fascia. So what is fascia? So the fascia, you can see it here in this image, the white filament here, that is the fascia layer. And next time when you go buy meat, look at the white filament. That is the fascia layer. So the fascia system is divided to two major categories: superficial fascia layer and deep fascia layers. So the superficial fascia layer, it's like a wrapping the entire body. It's like a Spider-Man suit, very thin layer under the skin wrapping everything. Why fascia could be an issue? Because when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. It compresses on everything underneath it. It prevents movement and decrease range of motion. So to make things complicated, but don't worry, the treatment is very simple. Each of the fascia layer has 2 to 3 sublayers on the top of each other. So the superficial fascia layer has 2 to 3 sublayers, and the deep layer have 4 major categories, and each of these categories have 2 to 3 sublayers. So the deep layer divided to 4 categories: the apparatic fascia layer that's wrapping a group of muscles, and you have the epimysin wrapping each individual muscle fiber. Then we have the premiysin, and you can see it here, the premiysin wrapping a group of bundle of muscle fiber. And at the end, each muscle fiber wrapped with 2 to 3 layers of fascia layers. So that's why it's extremely important to address the whole system, because when you start to have a scarring, it's kind of like gluing all those layers together. We have to work on the scar tissue to break the adhesion there, and then at the same time we have to loosen up those layers to work on these condition. So what I personally do, I use the A1 to release superficial and apparatic fascia layer, and then I use the A5 to release the epimysin, premiysin, and endomysin. So it's extremely important when you address plantar fasciitis to address those 3 issues simultaneously. You cannot pick and choose and say, I'm going to work on inflammation, and the inflammation is not going to break the scar tissue. The treatment for the inflammation is not going to release your fascia restrictions. And the treatment for scar tissue, it's not going to decrease your inflammation. The treatment for fascia is not going to relieve your scar tissue. So you have to address those 3 elements simultaneously for the best result. And I will leave a link underneath this video on how to get those tools you can use it at home. If you have any question, leave it in the comment section below, and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.